Hi, my name is Susan Crosby. I am the author of my heart book. I am also the creator of the class that you are taking. So I hope you're enjoying it so far, and it's very informative and educational for you. I created my heart book as a tracking tool for patients. Um, Being a patient myself, I wanted something that I could use that was easy to throw in my purse and wasn't too complicated and overwhelming with information, because I found the other tracking books to be a little bit overwhelming to me. So it starts off with a self assessment tool, which I've talked about a little bit in the course. It's really important to check in with yourself every day just to see how you're doing. And it's categorized into green, yellow, and red zones. And so, green zone is you're doing pretty good, you're taking all your medications, and you're feeling your weight's stable, and things are going pretty well. So, that's great. Yellow is you're starting to have some more symptoms, such as shortness of breath or weight gain of 3 or more pounds in a day or two, and having maybe to use more pillows or not being able to walk as far as you usually can, or maybe some swelling that you've noticed. That's the time that you need to call your provider and let them know of your symptoms. It's really important to call them because, um, and work as a team with them so they can help, adjust your medication so things don't get out of hand. And red is you're really short of breath, you're having chest pain, you need to call and probably go to the emergency room. So that's a self check-in page. It doesn't take long. It's also maybe 5 seconds. It's also has your doctor's phone number that you can put in there, and a pharmacy. It's important to use the same pharmacy and be consistent with that. So, and then it's divided into sections such as blood pressure and weight and blood sugars. A lot of patients have diabetes, so it's important to take your blood sugars if your doctor wants you to do that. And there's a really important, sleep is really important, and a lot of patients have sleep apnea. It's also important for your doctors to know if you're using more pillows than you normally do. Where do you sleep? Do you sleep in a bed, or are you having to sleep like in a recliner? Those are things that you need to tell your physician, and they may not ask, and you might not think to tell them. So make sure that you keep track of that. Keep track of your food and what you eat. It just keeps you accountable. And if you're on a fluid restriction, make sure you write down your fluid, how much you're drinking. It has an exercise page. This is important because if you notice a decrease or increase, maybe you've been able to walk farther than you can before, which is great. Or if you've noticed a decrease, I'm getting more short of breath, and walking upstairs than I used to. So make sure you document that too. There's a symptom page. Write down your symptoms, keep track of them, write the date and what kind of symptoms you're having. And so, because when you call the triage nurse, they're going to ask you. They're just going to ask you, well, what are your symptoms, and how long did you have it, and what date did you have it, and that way you have it handy for them so you can give them the most accurate information. One of my favorite pages is the gratitude section. And this is really important to keep track of your mental health, because a lot of patients with heart failure have depression. I know that I fall into that category, and I didn't pay attention to it like I should have, and it got away from me. So gratitude is a really great way to realize all the positive things you have in your life. It's so easy when you have a chronic illness to look at just all the negative things. I can't do this, I can't enjoy doing this anymore, I can't work, I can't eat this. And so it's just a way to kind of reframe your thinking, and I think it really helps. I find it really beneficial. So, and then it ends with questions page where you have space to write questions. Think about the questions that you want to ask your provider before you go to your visit. That way you don't forget what you want to ask. And if they pop up, in between visits, just write them down. And so that's another great way to kind of prepare you for your visit. So I really hope you enjoy my book. I think it's a great tracking tool. There's other tracking tools, but I like this one. Well, I created it, so I like it, but I think it's easy to use. So, and I just throw it in with my medications bin that I have, and do it in the morning as I'm taking my medications, and it's quick and easy, and you can carry it. And the idea is to share the information with your provider, so bring it to your appointments, and I think together it will improve communication, and they can develop a more precise treatment plan for you. So it's you can find it on Amazon, or you can go to my website, www.susancrosby.org, and I have a lot of other information on there too. Thanks.